Okay, good morning, everyone. This is Gyam from the Asia Pacific Hospice Palliative Care Network. I'm the Executive Director for the APHN. Today, I would like to first congratulate Spring Hospice Center for organizing the International Hospice Palliative Care Day Conference in Vietnam to celebrate the World Hospice Palliative Care Day. In this presentation, I would like to share with you what the Asia Pacific Hospice Palliative Care Network does in the region to promote the hospice palliative care in the Asia Pacific region. Firstly, about the APHN. The APHN is a regional non-profit organization that has been established in 2001. We are also a Singapore registered charity, and we have since seen 260 organization members with about 2,500 individual members spreading across 27 sectors in the Asia Pacific region. The APHN vision is to promote access to quality hospice and palliative care for all in the Asia Pacific region. We serve as to be an effective network in the Asia Pacific to promote and support the elevation of pain and suffering from life-limiting illnesses. So the APHN core values include respecting every individual's regardless of race, language, and religion. We also believe in the empowerment of the individual, family, and community, and recognizing individual and the family who are well informed of decision about the care. And most importantly, APHN value every moment of life, and we will not support any action that has the intention of shortening a person's life. Therefore, we do not support euthanasia. The APHN has many aspects of palliative care activities to meet our vision and vision. Today, we have education through webinars and forums, collaborative workshops, and e-learning platform. We help to build capacity through Lien Collaborative for Palliative Care program and various clinical observership and education program. We also collaborate with the region in terms of research projects, holding our biannual conferences, and has many special interest groups within our organization. We provide opportunity for everyone to join and meet us in the conference, and we also have communications channel including the e-newsletter and social media. Without further ado, I would like to plunge in some of the details of what we do. For webinars and forum, we organize it throughout the year on important palliative care topics and pediatric care topics. So the region, hospitals, and institutions are welcome to be our host partner to share the webinar and blast it throughout the hospital or the institution while we have the webinar forum. The one up and coming webinar, which is free for everyone, would be the Nursing in Palliative Care, and we have invited two renowned speakers from the region to share on that. It will be happening on the 16th of October, so everyone are free to join. APHN also organized collaborative workshop with the regions, mainly to educate and promote better understanding of palliative care to various healthcare professionals, students, and anyone who might be interested in hospice and palliative care. If you are a member of APHN, we will have a members corner where we share our e-learning platform on various resources for hospice and palliative care topics and video recordings of our past lectures throughout our training in the region. One of our flagship program is the Lien Collaborative for Palliative Care, mainly to aim building capacity through education. I'll share more in my subsequent slides on the Lien Collaborative program. We also organize clinical observership in some countries like Singapore, Taiwan, etc., to have hands-on experience and case discussion and including attachment to hospital, inpatient hospices, and home care services for various countries, representative, and interested parties to join in the clinical observership. One of the main activity that APHN has is the regional research collaboration across the Asia Pacific region. Today we have a Asia Pacific Research Committee, which we welcome the Vietnam colleagues to join us as well. The APHN organized the Asia Pacific Hospice Palliative Care Conference every 2 years, and this serves as a platform for international community to converge and showcase their work, make friends, and also aim to collaborate and improve hospice and palliative care within the Asia Pacific region. We also provide scholarship, bursaries, and award to healthcare professionals from the low to middle income region to attend conferences with us. Our upcoming conference will be the 16th Asia Pacific Hospice Conference, and that would be happening in Sarawak, the East Malaysia, from 23rd to 26th April 2025. The registration is open and the abstract submission is also open. We welcome all our Vietnam colleagues to join us in this big event. APHN has our social media that you can follow, and you are free to join our newsletter dissemination list. Very quickly, I would like to showcase our education program that we have in the Asia Pacific Hospice Palliative Care Network. So this is an overview of what APHN has in our training program. We started our training way in 2005 in Vietnam, and that was under the sponsorship of International Foundation of Singapore. And thereafter, we have certificate programs together with the Flinders University, and we also train in Jakarta and the various countries as stated here through the Lian Collaborative for Palliative Care, including Bangladesh, Myanmar, Sri Lanka. Our active program today include India, Bhutan, Sarawak, Timor-Leste, Laos, and Philippines. Let me give an overview of the training program in the Asia Pacific region. So I've talked about the Vietnam, Jakarta, and the Flinders University. So this is the 2005 and 2007 training that we have had in Hanoi and Ho Chi Minh City in Vietnam. It's a total of 6-week training over the 3 years, including clinical fellowships in Singapore. During then, we have trained about 8 doctors and 1 nurse. We have also collaboration with the Rachel House in Jakarta at the Damai Cancer Center, where we have similar train-the-trainer training for 5 doctors and nurses during the year 2010. And during the year 2006 to 2011, the Flinders University collaborated with APHN to provide the graduate certificate in palliative care course and also a diploma course, which see a cohort of 108 students across the region graduated. Today, you can see some of the familiar faces who are the leaders of their own arena in the country promoting hospice and palliative care, and we are very happy about the achievement. Next, I would like to share more on the Lian Collaborative for Palliative Care Master Training Program that we are doing in the low to middle income countries. This is actually a collaboration with the Lian Foundation and the Asia Pacific Hospice Palliative Care Network. The Lian program is conceptualized in 2012, and we aim to build capacity in the Asia Pacific region, focus on sectors with few or no services, and the whole program aimed to integrate into the mainstream government healthcare system for hospice and palliative care services. Basically, we look at community or country that need to be ready and want to develop hospice palliative care. We also look at local partners that could champion the program with us. With the help of the health authorities and government, also we will need to partner with a health institution to host the training, understanding the healthcare system, and advocate for opioid and essential medications access. So that's our scoping concept of the Lian Collaborative for Palliative Care training program. In the training program, our framework include a summary of below, including the faculty from international and local expertise, partnering with the tertiary hospitals in the country that we go to. And we also look for partners, funders, and mainly to train on the healthcare professionals, including doctors, nurses, allied health, and pharmacists. These are some of our testimony of what the APHN has done. This is the program that we did for the master trainer in Myanmar from 2013 to 2017. To date, we have trained about 28 trainees from 12 institutions across Myanmar and some of the tertiary hospital including Yangon, Mandalay, Yangon Children and North Okapela Hospital in Yangon. For Bangladesh, we have done similar 6 training module and completed the training in 2018. We see 50 doctors, nurses, pharmacists, and social workers that benefited from the program. Today, we are seeing more hospitals implementing palliative care program through our Lean Collaborative program after attending our Lean Collaborative program, including the hospital below that you can see, like Bangla Bandhu University Square Hospital, Hospice Bangladesh, Ashit Palliative Care Unit, and many more. A good testimony to the Lean Collaborative program would be in Sri Lanka. The Train the Trainer program completed in 2018. We have 50 trainees from 29 institutions across 5 cities successfully completed the program. And today, we see that the Ministry of Health has started to fund the training of more healthcare professionals in palliative care, including the president donating an amount to set up palliative care center in the teaching hospital of Karapitia. The Sri Lanka has advanced lead and bounds, and today we are seeing the national strategic framework set up from 2019 to 2023. We are seeing more and more new development in Sri Lanka, and we congratulate them for the job well done in promoting hospice and palliative care. Our flagship program has also been in India for the last 6 years, and we are very proud to have trained about 250 clinicians from 75 institutions to date across the state of India, as you can see from the map here. And to date, we have also seen about 40 institutions started the service for palliative care in the hospital across India. We are also proud to say that our partner, the All Indian Institute of Medical Science, has been conferred the title of Collaborating Center for WHO. And Dr. Sushma, as you see in the slides here, has been also appointed the head of training for WHO in the AIMS India. We also started China virtual training during COVID and trained about 22 hospitals across China. Currently, we have an active program in Bhutan where we started training for about 22 trainers, train the master trainers, and we are going to complete our 4th module in the next month in October. And the referral hospital that's partnering with us is the Jigme Doree Wongchak National Referral Hospital with the support of Ministry of Health. With this, I'd like to end my presentation of today's World Hospice Palliative Care Day event. And I welcome our Vietnam colleagues to go into our website in this link here to send us all the activities that you may have to celebrate the World Hospice Palliative Care Day, and we can showcase that in the Asia Pacific Hospice Palliative Care Network website. To end the presentation, I'd like to quote the author of J.K. Rowling: "To the well-organized mind, death is but next great adventure." With this, I thank you and congratulate Spring Hospice Center again for organizing the World Hospice Palliative Care Day event. And I welcome everybody to scan the QR code or come to our website to become a member for the APHN, to enjoy and meet up with like-minded friends to continue to advocate and implement Hospice Palliative Care Network in the Asia Pacific region. Thank you very much, everybody.